Here's a CT of the abdomen and pelvis, which shows a massively dilated gallbladder here. We can see a gallstone within the neck of the gallbladder. And so this patient ended up having a percutaneous cholecystostomy tube placed. On the subsequent imaging that was performed, we can see here that the cholecystostomy tube has been removed. There's much less distension of the gallbladder, but there's development of these hypodense lesions within the right hepatic lobe that you can see here, and so there was concern about these either representing infection, maybe a chronic infection such as xanthine granulomatous cholecystitis, or infection related to having cholecystitis, or whether these represent masses. And so we were asked to biopsy these. It was very difficult to see these by ultrasound. In fact, we couldn't see any of these lesions, either these ones here in the edge or these ones more centrally, on the grayscale ultrasound. So we ended up using contrast enhanced ultrasound. And here you can see here's your grayscale image, and then you have your contrast enhanced ultrasound image on the right. And as we're going through it and using contrast, you can see that the lesions in the edge are much more well visualized after giving contrast than was seen before. And you can see the other more central mass over here as well. And so it gives us two potential targets, either here in the periphery or over here. We ended up targeting, you can see our FNA needle going through the more peripheral one, as that one seemed easier to perform, and this ended up being cholangiocarcinoma.